Okay. I'm happy you all are here, and always kind of laugh about how we do that kind of uncomfortable getting ready, but yet you're here with us. So happy you all are here. We have a lovely presentation right now from our colleagues and friends here in Ohio, and I had some coworkers in other spaces where, if they went to the University of Ohio, they would say OH, and someone call it IO. So I don't know if you guys have had that experience there in Ohio, but I just wanted to share that little bit of knowledge I know. Um, but we have with us Grace, and I might butcher your name. Is it Schoessow?
Yes.
And okay, and Lillian McCree and Lindsay Green, who will be sharing with us their presentation from disparity to empowerment, advancing equity in early care for families and infants and toddlers with complex needs. And I look forward to hearing from you all and learning more as well. Thank you. I hand it off to you all.
Thank you, Dawn. So welcome, everyone. We're glad that you've joined us. We'd love to create some connections and conversation as we go along. So we encourage you to put your name and your role and where you're from in the chat so that you can be a part of the conversation. So we are aspirational in our thinking today. We have some goals for this session, and together we'll be identifying barriers to equity and taking a look at disparities. We're going to explore some ways to empower families and early care providers. We're going to extend our understanding of infants and toddlers with complex needs. And we're also going to encourage a mindset shift from wait and see attitude around infants and toddlers to let's be early and often in our approaches to intervention. So why do we do this work? So it's because we know that infant and early childhood mental health consultation is a powerful tool for making lasting differences in the lives of young children with complex needs. We'll be sharing some stories from our experiences as consultants and help bring it to life, including the realities of the disparities that we see, and also highlighting the possibilities, how infant early childhood mental health consultants are making meaningful differences, and we're doing so early. And that can change the developmental trajectory for infants and toddlers with complex needs. So we also have very personal reasons why we do this work. And for me, my journey began back in the 90s. I was a busy mom of a very busy baby boy, a clinical psych grad student, and working part-time for a nonprofit program that provided care for children while their moms worked on getting their GEDs. And I'll never forget the afternoon when I went to pick up my son and was told by the provider that I would have to find different care or pay double tomorrow. So I felt like it was a punch in my blind spot, and it set me on a journey that started with seeking early intervention services for my own child, and then led me into the world of infant and early childhood mental health. So that's my why.
Hi, I'm Lindsay Green, and I am also part of our early childhood mental health team. I'm the training coordinator for our team, and my why of why I got into this work. I am a former teacher. I taught kindergarten, and I was also an intervention specialist working with second grade students. And I have four children of my own, and after my oldest was born, I had a pretty rough experience with an in-home childcare provider, and so I decided to start my own in-home childcare because it was really difficult to find quality childcare for infants in our area. And I watched the teachers of children of, or I watched the children of teachers. Before I started my journey into the world of infant and early childhood mental health. So that's how I got into this work.
Hi, I'm Lillian McCree, and I am the Family and Community Partnership Liaison here at Greene County Educational Service Center. I've had a very diverse career path, many different stops, but I started the IEMCH consultation work later, where I saw the importance of early and often after working with K through 12th grades as an intervention specialist. But I would say My early beginnings were when I was a child protective service worker, and earlier than that, when I was serving active duty in the United States Air Force as a mental health specialist. So, one of the things we thought it was important to the audience is that we talk about where we are and where we come from. And as you will see on the big US map, we are in the Midwest. Ohio is referred to the heart of the Midwest. And then right here in Ohio, there's us, Greene County, and we're in the southwest region of Ohio. Greene County has a population of 168,412 people. In Greene County, we have Wright-Patterson Air Force Base, one of the super military bases in the internationally across the globe. We have the Air Force Museum, and we have a very close connection to the Wright brothers, first in flight for 12 seconds and traveled only 180 feet. But it proved that human flight was possible. We have 5 universities in Greene County, to include 2 historical Black college universities, Antioch College. We're also known as the Bike Path of America. Now, a word about Antioch College. It's famous for their alumni such as Rod Serling, Leland Clark, Leonard Nimoy, Coretta Scott King, and the children's author Virginia Hamilton. Now, where we work, Greene County ESC is located in Yellow Springs, home to Dave Chappelle. And no, we can't get any of you tickets because we can't even get tickets ourselves to see him. But little known fact, every day I go to work in the same building I attended in middle school. Now, in the blue map, which is really interesting, which was taken from the 2023-26 Community Health Needs Assessment. And this was a profile of the child opportunity measures that introduces quality of resources and conditions that matter for children to develop in a healthy way in the neighborhoods where they live. Now, the assessment reveals identifying and prioritizing needs and those resources to address needs. However, in Greene County, the diversity shows that it looks very different based on the zip codes, which means it's not so much equitable. Disparities in healthcare, geographic and transportation, racial and ethnic, educational, in addition to stigma and discrimination, social support, and family stress, are all significant challenges faced by children with complex needs. Limited access to healthcare services, insurance coverage, also, again, geographic and transportation disparities, racial and ethnic disparities, language barriers, and access to technology can all impact a child's learning and development. Additionally, limited social support networks and resources can lead to increased stress and mental health challenges for parents and caregivers. Economic inequities, housing and food insecurity can also affect a child's overall well-being. I want to present to you a case study. And this is my experiences. So it was winter of 2021, and we had our team, the IECMHC team, had received a self-referral from a single mother requesting assistance in finding a GED program. And that referral was given to me to make the call. And this was my first time as an IECMH consultant in my first family that I worked with. So I made the call, mother picked up the phone, I introduced myself and thought for a moment, maybe I was just too much for the mother at the time because she really wasn't asking many questions. And in talking, and the conversation was if it was, I had to tease a lot out and was pulling a lot of information. Because one, we knew it was going to be a layered phone call because we rarely get phone calls about GED programs to the IECMH program, really not at all. So we knew it was going to be a layered call. So I needed to jump in. I scheduled an appointment with the mom, and we set up a time for the two of us to meet the next morning. In preparation for that visit, I grabbed a We Care kit, which is a bag of resource materials that we share with families and providers. So at 8 o'clock, I knocked, and after identifying myself, a woman opened the door. I said, "Hi, Ashley. I'm here for a visit." So the woman said, "I'll get Ashley. I'm her mother." And I'm like, wow, a grandmother, a young grandmother at that. 2 children came out and they seemed quiet. First thing I noticed was the kids were pretty shy because they weren't talking. That's what I thought. One child was approaching 3 and the other was approaching 2. And I began talking with the mom after she came out. I tried to pick up on the conversation where we left off on the phone. I was not having any luck with the open-ended questions. So I immediately thought to divert the conversation and the attention to the grandmother. So the grandmother and I, we started conversing. And she said that she was the one that told Ashley to contact us because the pediatrician had given her, had referred her to us, and that she would make the call. Grandmother said the call was actually about paying for daycare because she comes every week for 3 to 4 days, helping Ashley out and watching the kids while she's at work. And she said, I have to take her to work. I have to take the kids to doctor appointments, and I'm worn out, and we need help. And she's on her phone all the time. And I don't think she's doing like she should do with the kids. The grandmother said, I'm really concerned about these kids because they're not talking. And what I believe is that the little boy is autistic like my son. Simple. I got what I needed from the family. I shared with them the We Care kit. The grandmother and the children were like, oh, wow. It was like Christmas to them. And oh, look. Ashley didn't seem interested until I pulled out the little green dude. I told her, this is a cell phone holder. What happens when you take off the phone off, there's a message right on the belly of the little green dude that says, how's the baby? I don't think she caught it, but she was happy to have a cell phone holder. I returned to the ESC. I made the necessary referrals. But in my reflection of the visit, I thought, being and years after that part of being an ECMH consultant is we don't always know what becomes of the families that we work with. However, the grandmother and the children's needs were also different and varying. And after a while, the cell phone becomes less frequent. I mean, the phone calls became less frequent. And at some point later on with follow-up, I did not get an answer as time went on. So in this situation, in this case studies, we had 3 generations, 3 competing priorities, all in one home.
Offering the right support at the right time for families and caregivers of infants and toddlers with complex needs is imperative to be able to ensure optimal social emotional growth and development and successful outcomes. The needs of infants and toddlers are increasing in complexity and severity each year, and this is causing strain on service providers and stress on families and caregivers. And we know that current brain science, combined with years of research into the transformational power of positive interactions and relationships, has opened the door to simple and effective ways of addressing complex needs early and often. When we talk about early and often, we're talking about an approach, a philosophy that guides prevention and early intervention efforts and infant and early childhood mental health consultation and early intervention services. Early and often is at times at odds with the time-honored and valid wait and see philosophy of practitioners and specialists in the medical and pediatric fields. And in the case study that Lillian shared, this is a perfect example of the outreach and the connection with the pediatric partners and the federally qualified health centers in our region, that we're receiving those referrals and those calls are being made so that we can connect with families. While we hope that they are starting on a journey and on a path, we often don't know where that journey leads, and that's the challenge. We are at this place where we're promoting early and often, but we also understand and respect the wait and see attitude as a really time-honored traditional approach based on expertise from the professionals that we work with. So when we're facing how to help a child with complex needs, we want to support families and caregivers being able to navigate the cross currents between these competing approaches to intervention and diagnostics and treatments. And supporting families through this journey can be challenging and stressful, but it's essential to ensuring optimal outcomes. So in this session, what we're talking about is an attempt to elevate the understanding of the ways of being as an ECMH consultant. So we all feel equipped to support families and caregivers of young children with complex needs in a helpful and hopeful process that promotes the mental health and wellness of young children, their families, and their caregivers on their journey towards healthier outcomes. We know that families and caregivers of infants and toddlers with complex needs are often feeling higher levels of stress, feeling hopeless, feeling overwhelmed, feeling pressure, lacking confidence, feeling some level of helplessness, feeling isolated and alone. We also know, as Lillian highlighted in her case study, that screen time is a real problem. So I'm kind of hinting at how we're feeling about it, but I asked, is this helpful or harmful? This is an open question and up for debate because there are some resources and things that we cannot get enough of that we have access to on our phones. But we also know that use of screen among children has concerns, and it can impact their developmental outcomes. So we know that it's really important to be sharing age-appropriate guidelines for screen time. And for 0 to 2-year-olds, the recommendation American Academy of Pediatrics is no screen time, with the exception being video chatting, FaceTiming with family members. And this is because infants and toddlers need to be able to interact with caregivers and their environment to promote healthy brain development. And for those 2 to 3-year-olds, a max of 1 hour a day, and limiting screen time to educational information or things that are going to boost that engagement between a parent that's co-viewing with the child. So the risks of too much screen time on early childhood mental health and brain development, social emotional development, is something we should all be paying attention to. We know that this can impact their face-to-face interactions, and this can reduce their ability to bond and develop social skills, can delay language, and it can have a cognitive impact. And too much screen time can affect the ability to develop learning skills and reduces opportunities for exploring the world and having those play-based and sensory experiences. So we encourage you to take a look at the conversations that you're having around screen use, especially when it's interfering with a child's development or with your ability to provide IECMH in the home environment. So we also would encourage you to think about some risk factors that compound the difficulties accessing services and what we see and what we're looking out for. These are risk factors that may be impacting your family. So if some of these resonate with you, or if there are other things that you're thinking of that come to mind, feel free to plop them into the chat and share. We know that cultural factors can significantly impact disparities for infants and toddlers, and in Greene County, given its diverse composition, including the Air Force Base and colleges and universities and rural communities, there are many ways that cultural factors are contributing to disparities. And we have many of these listed. It's important to spend time identifying local barriers and have this be a part of our conversations and be actively talking about the impact on equity in early care. So we know that cultural factors do impact the care that's provided for children in Greene County, and we are driving those conversations. So here are some different cultural factors that are impacting equity. So access to healthcare, language barriers, military culture, educational level of attainment, socioeconomic factors, the cultural competence of service providers, beliefs in the communities. We have rural communities that have distinct cultural beliefs and differences in values relating to childcare and healthcare access. And understanding and respecting these beliefs is essential to being able to provide high quality infant early childhood mental health. And then the stigma around mental health. There's cultural stigma in Greene County relating to developmental disabilities or disorders and mental health, and it can deter families from seeking early intervention services or being willing to follow through with a referral. Or again, as in the example that Lillian gave with the case study, that the reason for the referral and what they were able to identify as why they called were two separate things, and we believe that that had something to do with the stigma. So what are some of the barriers that you're facing in your area? We also know that we have additional barriers and considerations for families that are struggling with mental illness or addiction. And so we're very sensitive to issues around shame and stigma, trouble with accessing treatment, and beliefs and biases about child welfare system. We're very sensitive to parent stress, access to treatment, isolation, adversity.
Right. In the chat box, I see barriers being put through the ringer, having it due to negative past experiences, and the bureaucracy mill.
Absolutely. Thank you for sharing. So let's take a look at who is providing early care in your community. This is different for each community that we work with.
Yeah, I'm going to ask an easier question that is not as hard to think about. Who provides early care in your community? So if you can type a list in the chat box, that would be great, or just one or two folks who provides early care in your community. We'll go over them in just a minute. So families with a child with complex needs may encounter various types of early care providers as they seek services and supports. Addressing disparities here in Greene County requires a culturally responsive approach that considers these cultural factors and tailors early childhood services to meet the unique needs of our diverse communities. Cultural competence among service providers, inclusive outreach efforts, and community engagement are key strategies to promote equity and access for all infants and toddlers in the county. So you can see from the list in the chat box, which there are many different types of providers. You guys, I think, hit them all. So thank you so much.
Several times over.
Yes, several times over. Wow, great
Yeah,
list.
especially local and nonprofits, which is really an interesting one, that are providers within the care community.
Right. And we do want to highlight, though, that more is often not better. We want to try to create a comprehensive approach where providers can communicate with each other and the family involved can be less complicated, and with the family involved, so it can be less complicated and more empowering for families. Just like the earlier response, that we don't want families to feel like they're being put through the ringer. We want them to feel like they have contact with anyone involved in their care. So thank you. So here are some of the local IECMHC efforts that we've done here in Greene County. We have initiatives that include efforts to increase awareness and spread knowledge on various topics related to early childhood development and well-being. So here are some of our local efforts that we've used to address disparities, promote equity, and increase children's overall mental health. We want to highlight that we're a fairly new program, and Grace started it with just herself, and we have grown from there. But a lot of these efforts were started with just one person. And so if we could do it here in Greene County, people can put these into place anywhere. So we do our positive parenting education and support, and we offer several opportunities each month for caregivers across the region to join virtually, where we spend half of the session covering strategies and then the second half answering questions. We also have our Disconnect to Connect campaign, where we're promoting the awareness about the potential negative effects of excessive screen time on young children's development. We partner with community organizations to offer resources and guidance to caregivers on establishing healthy screen time limits and promoting face-to-face interactions. We also work to prevent the expulsion or suspension of young children from early care and education settings. This involves providing training to educators and caregivers on managing challenging behaviors, creating inclusive environments, and finding alternative solutions to expulsion. And then we utilize a program called HOPE, which stands for Healthy Outcomes from Positive Experiences, whereas we educate families and caregivers and educators on ACEs. HOPE initiatives focus on promoting positive early childhood experiences that enhance children's social, emotional well-being and resilience. Our other local community initiatives include our early intervention cross-sector partnership for screening and intervention, pediatric and children's hospital outreach and partnerships, community children's mental health team collaborative, partnership with Children's Services for on-site IECMH consultation, and then early Head Start, and with our local Air Force Base, Wright-Patterson Air Force Base Child Development Centers. I want to share a case study from an experience that Lillian and I had providing a parenting session with one of our local community groups. There was a parent who attended with her kindergarten child and twin infants. She was very friendly but shy, and she attended alone with her children. During our time together in that very first session, I noticed that she kept her babies in their double stroller, in their car seats. Here in Ohio, we call them pumpkin seats, which I just think is a fun thing to share since we're across the nation. I'm not sure why we call them pumpkin seats, but I think it's kind of cute that we call it that here in Ohio. They were buckled in their seats through the whole class. It was our first session together, so I'm not sure if she felt uncomfortable taking them out, but the twins were quiet and seemed content in their car seats, but they were awake and they stayed in for the entire hour that we were together. Upon reflecting on this session, it seemed counterintuitive to what the class was about. We were talking about the importance of positive interactions and talking about serve and return and how it can build a stronger brain, and really just the importance of connecting. And so after the class, I spent some time reflecting about it and decided that I wasn't helping the mom out by telling her that it was okay to get her babies out. It was okay if they cried. It was okay if they made noise. It was okay if they needed a diaper change or needed to be fed, or if they babbled or laughed. Like, any of that was okay. We were there as a group together to support her. So before the next session, I made sure I brought a blanket with me. And when I got there, I talked to the mom before class started, and I offered to put the blanket on the floor if she wanted to lay the babies out on the floor, or I also offered to hold one of the babies while I taught the class. And I asked if it would be okay if I got one of them out of the car seats, and she seemed really excited and wanted them to take a role in the class. So I was able to hold one of the baby girls while I taught the class. And it was just a much more joyful and connecting experience to have them as part of the class. And then from that point on, the babies were part of our sessions together. So for the next 5 classes. We did 6 classes total. They were part of the sessions and joined in the activities with us, and we got to watch them grow up over those few months. So from that point on, I just was thinking about how the reflective process is so important, because I think young parents can really feel judged and uncomfortable and aren't sure of the most socially acceptable way to have their infants out in public. And as IECMH consultants, we can do our part to support and empower caregivers and let them know that their babies and children are always welcome, no matter what state they're in and when they're with us. So I want to invite you to share your own success story. I'm seeing a question in the chat box.
Yes, it's about serve and return.
Yes, and Grace put a great link in the chat box. Thank you, Grace. Serve and return is just about the importance of those connecting moments where a child is basically serving to us and we're returning the serve through our interaction. And it's really important for healthy brain development in young children. So it's a really important thing that you could share with any caregiver or educator. So what we would really love for you to do now is to hold a success story in your head and in your heart. And we all have successes, and sometimes we don't focus on those as much. We tend to go towards the negative as humans, and so and focus on our mistakes and our misgivings. And while those mistakes give us opportunities to learn, our successes are what drive us and keep us from burning out. So to avoid burnout, stress, and anxiety, we have to be reminded of the good. And since we can't always depend on other people to help remind us of our successes, we need to create structures for ourselves to remind ourselves of the positive and to use gratitude. So we would like for you to please think about a success story that you want to share. And while we would love to take the time for everybody to share a success story here together, unfortunately, we don't have time to do that. So please grab a Post-it off your desk, or put an alarm on your phone. And then tonight for me, it would be after my children are in bed, after the dishes are done. And then instead of mindlessly scrolling on my phone or watching Netflix with my husband and not talking to each other, I would want to share my success story with him. Instead of the negative thing that happened to me today, I want to share something good that happened and ask him to do the same. And if you don't live with the person that you would want to share your success with, call them up on the phone, and ask them to share a story with you too. And then please notice how you feel as you share. Did you smile? Did you laugh? Did you get a warm, fuzzy feeling? Those are the feelings that can inspire us and guide us, and that we need to hold on to as we do this very important work.
Yeah, thank you, Lindsay. So Ohio's investment in early childhood matters, and we're embarking on a new journey. We have a new Department of Children and Youth that is combining all the agencies you see listed below in the gray banner into one new state level agency that's going to help streamline the services. And so this investment will help drive the services in the future. And we feel like this is going to be really helpful. It's going to help elevate the expertise around early childhood mental health and open up access across sector, across systems. It's going to help universally promote social emotional development and the connection between brain development, reading, all of these things that we care about when we get to school age. In the early years, what are those foundational pieces? It's going to help advance the understanding of trauma and the impact on trauma. It's going to help support families and help them get access across systems. Because earlier, someone talked about the runaround or the wrong doors or the dead ends that we're all so frustrated by. So this is a concerted effort to try to do better as professionals serving children and families. So we'll let you know how it goes. This is an active work in progress. But we do also want to really work on preventing and addressing mental health challenges not just for the child, the infant or the toddler with these kind of complex needs that we have trouble understanding how best to support, but all the adults that are providing care for the child. How do we do that and do that well? That's what we're in the process of undertaking. So now we're going to pivot, less heavy, more interactive.
Right. So we're going to do an activity called a spectrogram. And we're just going to start out with a pretty simple question with how long have you been in the field of IECMH? So in a minute, I'll go to the next screen and you'll see a line for 0 at one end and 100 at the other. So 100 would represent a long, long time, and 0 represents for a very short little bit. Maybe you just started yesterday. So you're going to annotate on the line to indicate where you land. So if you could go up to the top of your screen, you'll see view options. And underneath view options, if you click on it, it will say annotate. Then you can click on the toolbar on your left, click on the check mark, and then you can put yourself on the line with where you land. And if you would prefer to just type in the chat box a number between 0 to 100, that's okay as well. All right. Everyone's doing great. It looks like we've got
impressive.
a lot of newer folks.
Right. Yeah. If I would say we have those either at the beginning of the career and those approaching just before midway, which in a way I see that as a very positive sign. In the content, in what they're learning about the brain science, which is it really never ending. You can never get enough of that.
Right. Okay, we're going to do one more. So this next one is going to be how prepared do you feel right now to address equity in early care for infants and toddlers with complex needs? So again, 0 would be unprepared and 100 is very prepared. So go up to view options again, annotate. You'll see the toolbar on your left, and you can click on the check mark and indicate where you land on that line. If you feel 0, not very prepared, or 100, very prepared.
Looking pretty equitable, not much towards 100, which it is a journey. It is a journey.
It is a journey. Sometimes I feel prepared and sometimes I don't.
Right.
Depending on the success story for the day.
In there are many times that I'm such a learner. I can't get enough of the stories. I can't get enough, and it just builds on my knowledge. So I would say I feel prepared, but not an expert.
All right. Well, thank you, everyone. All right. And then Lillian's going to talk about how we can have a role in empowerment.
Yes. Infant and early childhood mental health consultation can drive empowerment. It is a program that provides early care providers with enhanced understanding of young children's social and emotional development. It also offers individualized support, improved communication skills, and evidence-based behavioral strategies for managing challenging behaviors, as well as emotional support and cultural competence training to help providers manage their work and create culturally sensitive environments. The big thing about IECMH consulting, it fosters collaboration among providers, families, and other professionals, leading to that more comprehensive support and even that cross-systems support. Providers develop stronger problem-solving skills, reduce burnout, and data-informed decisions. And this empowers them to provide high-quality care, ultimately leading to better outcomes for children and families in early care settings. I'd like to talk about empowerment through acknowledgement. On the next slide. So you'll see on this slide, you see a list of, as consultants, the areas that we need to just, at some point, it becomes organic to ourselves when we are working with families. And that is empowering through acknowledgement, considerations, respectfully acknowledging infant or toddler's complex needs, differing perspectives, conflicts, contradicting opinions, and disregard for best practices. We hear these things. We also hear about from babies unrealistic expectations and invasion of and they're feeling as their privacy has been invaded. As consultants, we have to not let this be barriers to the work we do with families.
Yes, and so we're in the business of changing belief and attitudes. And the Center of Excellence and what we're doing over these few days is really helping us to be able to have the kind of insight that we need in order to be able to help support the change of attitudes and beliefs. So how do we do that? What are we doing locally to be able to help foster the change in mindset? Well, we're focusing a lot on education and training. We provide robust reflective practice. We seek it out, and we also provide team experiences to be able to have those reflective spaces. We are working on cultural competence at all times, helping professionals understand and appreciate diversity of families and children that they serve. It fosters open and inclusive mindset. We're promoting a trauma-informed perspective. We also are looking at everything through a strengths-based approach. And many of our partners that we work with, they turn to mental health to help identify the issues or look for a fix. And when we show that's a mindset shift that we need to be aware of and help foster. We work together and have collaborative partnerships. We promote professionals from different disciplines entering into these types of conversations about the perspectives that all contribute to a more inclusive approach. We honor the family-centered care and the types of caregiving that are happening in communities. We also like to look at data and make data-informed decisions, even though it can be painful. And we also encourage advocacy. So sometimes we have to be the voice for the people that we are supporting, the little people and all the adults that are supporting those children. We also like to learn from each individual case and provide those reflective spaces and opportunities to learn. We do all things with empathy and compassion, and we are continuous learners. So in order to be able to achieve these things, we need to have shared language. So having a shared language among the providers of early care is absolutely essential when you're discussing complex developmental needs with families. And then you expect those families to go and advocate for their child and talk to other providers of care services. So we are striving for clarity and understanding. So the shared language will ensure that all providers, doctors, therapists, educators, specialists, are using the same language. It allows for effective communication. It allows for consistency in care, so everybody understands what's being asked for and what's being done. It is empowering for families. So having that shared language, then when parents and caregivers understand the terms and the concepts that we as professionals just throw around, the jargon and the acronyms, then they're able to use that information to make informed decisions. And they can also advocate for the professionals to stop using those terms that are too confusing and shut them out of decision making. It also helps reduce anxiety. So complex developmental needs can be overwhelming for families, and having a shared language can reduce anxiety by providing a clear framework for discussing the child's condition, the treatment options, and the expected outcomes and the interventions. So our use of shared language is really intentional and empowering, and it plays a crucial role in facilitating the empowerment of families. And it also can help connect providers, because this is not easy work to engage in as we do this cross systems work with children's services workers and early intervention specialists and early educators and care providers, pediatricians. Everybody has their language and their terms. So it's not an easy task, but it's absolutely essential. It means that we need to do more education and training. We need to engage in mediation and facilitation. And then again, circling back to being able to support families as we, at the same time, parallel process, work on promoting collaboration with other professionals. Sounds simple, doesn't it? So all of this is part of a broader mission in Ohio to promote inclusive environments. So Ohio has a program that is focused on preventing expulsion from preschool. And it's actually not just limited to preschool, so for it also includes infants and toddlers. So you can make a referral if a child is potentially being asked to leave or suspended or expelled from a care program. So this has also driven discussions around what do inclusive environments look like, and what can we do to provide the education and training in order to be able to ensure inclusive environments in education, all educational settings and care settings in Ohio. So there is now a credential, and I think we're going to pop that into the chat at some point and provide that information. And if we had more time, we would talk about it more. So the other piece that I want to mention is it's worthwhile for each of us as infant early childhood mental health consultants to invest our time and energy in regional partnerships and local workforce development, because we can be the voice for children and families and caregivers that are really feeling too taxed to be the day-to-day, because they're busy with the day-to-day management of the needs of children, to be the voice for them and help them make a difference. The partnerships can be with local colleges and universities, hospitals, military bases. The partnerships can extend as broad as their imagination allows. So we encourage you to look for those opportunities to be a voice for children and families.
What can we say about data? Well, when it comes to a cross-systems approach, it's part of that shared language in numbers. We all understand numbers, they are universal, but it helps to address disparities in early childhood development. We know this, and it's particularly with infants with complex needs. It informs decision-making, and it performs equitable access to high-quality services, going back to that blue map at the start of this presentation.
Yes, so we are going to leave you with this idea that as infant early childhood mental health consultants, we really strive to honor that all adults are helping children develop in a complex world of interactions and experiences. And we appreciate that you've spent this time with us. We have some resources that we'd like to share. We would love for you to be able to reach out if you have any questions. We wish we had more time. But we're wishing you all well in your journey as infant early childhood mental health consultants.
Thank you so much.
Oh yeah, thank you, Dawn. And here are the
Yes.
resources that we have to share with you all. If you are still on annotate, you probably need to go back to the annotate button under view options and click on the toolbar on the left again. At the top, there should be a triangle that looks like a mouse. If you do want to click on some of these resources, I see several people trying to click, but we wish you all well. Thank you so much for coming to our session today.
Thank you. Very wonderful session, Grace, Lindsay, and Lillian. Lots of
you.
information to look through. Very
Thank
helpful.
you.